And we are so glad to have you here with us on this Tuesday morning. Again, a beautiful day coming up. We'll cover more of those bases here starting at noon and the absolute latest on the disappearance of Nancy Guthrie. First of all, we begin with Kate Parsons. Kate is joining us here this morning, and Kate says your title is the Faith-Based Coordinator for the Hamilton County Coalition.
Yes.
Tell me exactly what the coalition does and where you come into play on this.
Absolutely. Hamilton County Coalition covers not just Hamilton County, but we service over 16 counties. And we work to bring education and training and prevention so that we can address the substance use crisis that we're currently in.
How bad is the substance use crisis we're in?
It's not going anywhere for a while right now. You know, we're seeing the numbers for overdose decline slightly, but we still have a lot of room to improve.
Without putting actual numbers on this, let's say 5 years ago, are we higher? Are we lower? Has it plateaued out? What sort of trend are you seeing?
So it's definitely gotten higher, but last year, I believe, was the first year that we've seen a reduction in overdose deaths. So the work that we're doing is helping.
Oh, no question. Why do you think those numbers are getting higher?
I think it's a lot comes to how easy it is to access and just the content of the drugs nowadays. They're not anywhere near as, as like when I was younger, when I was in my active addiction. Now, just the smallest amount could be fatal.
How long have you been in recovery?
A little over 26 years.
Looking back, the whole scenario 26 years ago, as you mentioned, was a lot different than it is right now. I remember an instance where a narcotics officer had a pen much like this one and put it into a packet of Sweet and Low, shook it off, and he told the group I was with at the time, this much fentanyl will kill you.
Yeah.
Not can kill you, will kill you. And it seems like so many people now are taking a gamble, not just with their health, but with their lives on this.
Yeah, it is a disease and it is incredibly difficult, but something that people can make through in recovery. And that's one of the things we do at Hamilton County Coalition is provide support so that people can find sustained recovery from addiction.
What is the first step to sustained recovery?
Wow, I feel like it's different for everyone, but I would say support. Find your support somewhere, whether that's through a treatment program, whether that's through a support group, a 12-step program.
In your case, what was the first step?
Wow. For me, I don't know if it was the first step, but for me it was all about finding why I was using in the first place. Because it wasn't because everything was going great, it was because I was trying to escape something. So, recovery is not just about putting the substance down, it's about rebuilding your life so you don't want to go back to it.
How hard was it for you to maintain? And is it still as hard today as it was 25 and a half years ago?
Yes, so I went through a period of extended sobriety where I had, 15, almost 20 years of sobriety under my belt. And when the pandemic hit, I relapsed. And so I definitely have a lot of experience with that. I have a lot of empathy for people who have, struggled with that and with relapse. But it just confirms that this is a chronic relapsing brain disease, and it's true.
And with a lot of cases, whatever the user is doing, generally speaking, and correct me if I'm wrong, they are not running towards something, they're running away from something.
Yeah, absolutely. One of my directors at the state says that marijuana is not the gateway drug, that trauma is the gateway drug. And I think that's true because a lot of people, reach for something when they're trying to escape something bad that happened.
Very well put. You have a conference coming up, correct?
I do, yes.
Tell
absolutely.
me about this.
It's called Paths to Recovery. It's our annual fundraiser for Hamilton County Coalition. And at this fundraiser, we have general sessions, and then we have breakout sessions. So the people in attendance will get to choose between the community track, the faith-based track, the prevention track, and the medical track. And the reason why we have all those is because kind of everybody comes to recovery from a different perspective and a different pathway.
What sort of folks are you going to see at this conference? If you had to, and I don't want to put a broad brush in your hand, but give me an idea of the kind of folks you will see at this.
Because of the range of content that we're able to provide, I think we're going to see a wide range of attendees as well. So in past, last year we saw clinicians, we saw treatment counselors, faith leaders, nonprofit leaders, and then just people in recovery too. People with lived experience want to come and learn as well.
What about those who are addicted? There is no stereotypical addict or user anymore. What kind of folks do you think you will see in that area?
Well, that's the thing. There is no stereotypical. I think that it's really easy to to make it sound like there are other peoples that are struggling with this and not us, but addiction is flooding into every sanctuary and home and neighborhood and school. So we have to come together to address it.
Are you still looking for speakers or for community
Yes,
partners?
we are. We absolutely are. For speakers, we are looking for anyone who has a story to tell, anyone who wants to help break that stigma, has any kind of information they want to bring to the masses. We have a presenter portal where they can go and apply to be a presenter. And then as far as the sponsors go, we would love to have sponsors, and those sponsors will be in the program itself, in all of our material, but also just to know that they're contributing to an organization that has boots on the ground support for our community.
What if somebody calls you and says, Kate, my company wants to be the sponsor for this? How do they get in touch with you?
The best way to get in touch is going to the website, hamiltoncountycoalition.org, or you can email me as well, and it's kate.parsons@hccoalition.com.
Again, hccoalition.org. Kate, good to see you.
Thank you.
Best of luck on the conference that's coming up. Hang in there. We have more of Let's Chat right around the corner.